Hello everyone. Today's presentation offers a critical and psychological review of the classical film Shock Corridor, released in 1963 and directed by Samuel Fuller. This review examines the film from an academic and psychological perspective, focusing on its portrayal of mental illness, identity, and consequences of hospitalization. Shock Corridor is an American psychological drama directed by Samuel Fuller, released in 1963. The film is known for its intense narrative style and its controversial depiction of mental illness within a psychiatric institution. The film follows Johnny Barrett, an ambiguous investigative journalist who deliberately commits himself to a mental hospital. His objective is to solve a murder that occurred inside the institution and win a prestigious journalism award. While Johnny initially pretends to be mentally ill, prolonged exposure to the institutional environment leads to a gradual breakdown of his mental stability. The central conflict lies in the blurred boundary between sanity and insanity. From a psychological perspective, the film explores themes such as psychosis, trauma, and identity disturbance. It highlights how extreme stress, prolonged exposure to pathological environments can precipitate genuine mental illness. Several patients in the film exhibit symptoms resembling schizophrenia and trauma-related psychopathology. While dramatized, these portrayals reflect early cinematic attempts to visualize severe mental disorders. Shock Corridor offers a critical view of psychiatric institutions, portraying them as rigid, controlling, and dehumanizing. The film suggests that institutional settings can worsen psychological distress rather than facilitate recovery. Johnny Barrett represents an individual driven by ambition and obsession. A psychological decline reflects how unchecked goals and exposure to trauma can lead to emotional exhaustion and psychotic breakdown. The supporting characters serve as symbolic representations of broader social and psychological issues, including war trauma, racial conflict, and ideological extremism, further enriching the film's psychological depth. The use of black and white cinematography enhances the oppressive atmosphere. Surreal hallucination sequences visually represents Johnny's deteriorating mental state and reinforcing the theme of psychological confinement. From an ethical standpoint, the film raises serious concern about the exploitation of individuals with mental illness. Johnny's manipulation of the system highlights the moral consequences of using mental illness as a means to an end. The film's strength lies in its fearless engagement with psychological themes, its critique of mental health institutions, and the intense performance that convey emotional and cognitive distress effectively. However, some portrayals of mental illness are exaggerated and may not align with modern diagnostic standards. The film reflects the limited psychiatric understanding prevalent during 1960s. Overall, Shock Corridor is a psychologically intense and social critical film. Despite its flaws, it remains significant for its attempt to confront mental illness and social neglect through cinema. Finally, we arrive at the conclusion of the review. Shock Corridor stands as a powerful psychological drama and illustrates the fragile boundary between sanity and insanity. From an academic perspective, the film underscores the psychological consequences of hospitalization, ambition, and ethical neglect. While its representations are dated, the film